Bouve students have a strong knowledge base.
The students that I see are incredibly passionate.
They're invested in their future.
They're very inquisitive, they're very self-directed.
There are opportunities to work at some of the best hospitals in the nation.
They're going to get exposure right off the bat.
Great opportunities to be exposed to research.
They want to develop new technologies. They're highly entrepreneurial.
And actually make profound differences in the world.
I'm majoring in the health sciences with a concentration in pre-med.
I'm majoring in physical therapy.
I'm majoring in nursing.
I am a pharmacy major.
Speech, language pathology, and audiology.
I am Bouve.
I am Bouve.
I am Bouve.
First, starting off with the skeletal system. Our skeletal system is a system.
I love teaching. I love watching the students learn about their body because it's anatomy and physiology.
The teachers here are so passionate about their work.
Piling cartilage into bone.
I love to see that light bulb go off.
The faculty definitely sets the highest standard.
The faculty is very demanding,
expecting us to meet certain goals.
They expect a lot out of the students. You have to work hard for the grades.
The academics have definitely been challenging, but something that I've been able to accomplish with hard work.
Not only do the bright students ask good questions,
they each bring very different perspectives.
Be critical thinkers and question the answers that I give them.
And that's a very rich learning environment.
It's very nice having all of healthcare in one building in Baracus.
Students are exposed to working with other healthcare professionals.
The nursing students will also interact with pharmacy students, physical therapy students, health science majors.
It really allows for a team approach to taking care of patients.
I love the chance to help people on a more personal level.
There you go.
And that's what excites me about being a nurse.
Northeastern is attracting some of the top researchers in the country.
I've been given the opportunity to do real research with real faculty experts.
I've built a multidisciplinary research team consisting of nurses, physicians, psychiatrists.
We have faculty involved in drug discovery, drug development, delivery, and imaging.
My research lab is highly interdisciplinary, and that makes the blend of students really exciting within the lab.
This institution really values research that addresses solutions. This year alone, we have 4 undergraduates working with us on research projects.
I'm working with my pharmacology professor, and we're researching a new treatment for Parkinson's disease. I presented our research at the National Neuroscience Convention.
The students in health sciences have an opportunity to be involved in co-op.
The co-op programs here at the School of Pharmacy can range from working in community practice or hospital, but also being exposed to industry.
In my co-op at Dana-Farber Cancer Institute in Boston, I worked with chemo drugs.
They get to work in one of the best hospitals in the nation.
I work in the audiology department at the Massachusetts Eye and Ear Infirmary.
Cardiology clinic at Children's Hospital, Boston.
After students go on co-op, when they return to the classroom,
they've often learned more about themselves and what they want.
The Hospital of the University of Pennsylvania.
Children's National Medical Center in Washington, D.C.
Sloan Kettering in New York City.
At South Shore Sports Therapy.
I worked in a pharmacy that specialized in HIV, oncology, and transplant drugs.
They look at the material in new ways.
And they'll raise their hand and they'll share that experience they had with the class.
And they ask really thoughtful, important questions.
I am Bouve and I am global.
We've had our students work abroad in countries like Ireland, Australia, Tanzania.
I am working to prevent HIV in Africa.
I'm going to Hong Kong.
I had the opportunity to travel to Niger, Africa.
Nepal, Costa Rica, South Africa.
My co-op in Mexico and Bolivia was very eye-opening.
When I came back from Africa, I realized how much work there was to be done.
Because I got to observe their healthcare system.
One of the projects I'm involved with is to develop a cooperative arrangement with Nelson Mandela University in South Africa.
Lots of opportunities for students to explore.
For my PT project, I am working in Ecuador in an orphanage.
And expand their horizons.
I am committed to urban health research.
Urban engagement is critical to the mission of Northeastern.
And provides solutions for real-life problems in the community.
And that translates to opportunities for students to actually make a difference while they're learning.
I've been working on the Bouve Health in Motion van, providing healthcare services to underserved populations within Boston.
We are running the annual Bouve Health Day, doing free flu shots, free hearing tests, cholesterol tests, bone density tests.
It's about getting into the community, learning from the community, and learning with the community.
I love living in Boston.
The Northeastern campus is really beautiful and green. It feels like our own little space in the city.
It's fun to explore the neighborhoods of Boston.
Bouve is definitely a small community within the large university. The Office of Student Services, whether it be upper-class mentors that are here to help you.
Bouve gave me the type of support I would have gotten from my family if I had been at home.
Our students are known for being able to hit the ground running when they graduate.
I am very excited to graduate.
And they graduate with work experience.
I haven't even graduated yet, and I already know I have a terrific resume.
Students, when they graduate, are very marketable.
I'm getting my clinical doctorate in physical therapy.
I want to become a public health nurse and have an impact on the community.
After I graduate, I want to go to graduate school.
The health science major is a springboard to a variety of health careers.
Career in academia and research.
When I graduate, I would like to work with children with autism and Down syndrome.
I've been accepted into the Tufts Medical School Early Assurance Program, and I'm going to be a doctor.
I am Bouve.
I am Bouve.
I am Bouve.